Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 101, Drowning, Guns, Healthcare, and What People Say. It's hard to imagine a more preventable cause of death. No one is going to say, "Oh well, some people just drown." That quote is from William Ramos, an associate professor at Indiana University School of Public Health, Bloomington, and the director of the school's Aquatics Institute, according to a recent New York Times article. The quote has relevance to both guns and healthcare, and I will get to that. But first, I want to review some facts about drowning, because I fear that many people don't understand the magnitude of the problem or how drownings happen. Drowning is the leading cause of children's deaths who are 1 to 4 years old. Drowning is also known as the silent killer. Movies often show drowning people calling for help, but often they can't call for help because they are struggling to breathe. Silent drownings are the norm, not the exception. A drowning person will last only 20 to 60 seconds before going under, and once underwater, they have at most 4 to 6 minutes before death. Drownings can happen in buckets of water, bathtubs, and of course, swimming pools, rivers, lakes, and oceans. If you have young children, always watch them carefully when around water. Empty buckets as soon as possible. Drain the bathtub as soon as possible. Always remain in the water with a small child in a swimming pool or other body of water if they can swim. Even if they can swim, it's a good idea to remain in the water with them. Turn off your cell phone and pay attention to your child. Focus on your child. Remember that any distraction could be deadly. Again, drowning is a silent killer. Pay attention to your child, and if you think your child has a problem, get them to safety. You will never regret an unnecessary rescue. Please note that unless you are trained, attempting to rescue an adult can and most likely will put you and the drowning person in danger. Let a lifeguard know if you suspect a problem. The United Nations has called on countries to address drownings. However, the United States remains one of the only developed countries without a national plan to address this crisis. It seems the U.S. is saying, "Oh well, some people just drown." That sounds familiar to me. Oh yeah, it's just like we say, "Oh well, some people just die from lack of health care." In fact, there are more than 76,000 unnecessary deaths per year for lack of a national health care plan. We can also add guns to the list. In 2021, there were 48,830 gun deaths in the U.S. The rate of gun violence has increased substantially since 2010, and gun violence was the leading cause of death for children and teens ages 1 to 19, according to the Johns Hopkins Center for Gun Violence Solutions. Research has shown that more guns means more gun violence. Whether guns kill people or people kill people is moot. The fact is, people with guns kill people, and that means guns need to be regulated at the federal level. Instead, we are saying, "Oh well, some people just get shot." I have already mentioned healthcare, and as I previously said, more than 76,000 people suffer unnecessary deaths because of our healthcare system. The United States is the only developed country without a national health plan. I take that back. Our national health plan is, "Oh well, some people just die from lack of health care." As mentioned previously, Professor Ramos said about drownings, no one is going to say, oh, well, some people just drown. But sadly, I think what people are saying is just that. Oh, well, some people just drown. And when it comes to guns, we are saying, oh, well, some people just get shot. Finally, when it comes to healthcare, we say, oh, well, some people just die from lack of healthcare. We know what we need to do to greatly reduce and possibly end the carnage caused by drownings, guns, and our healthcare system. Instead of saying, oh, well, we need to say, it's time to do something about it at the national level. And for our healthcare, we know that something is Medicare for all. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.